Welcome Dr. Ng Char Hong to our very second episode of Hot Seat with Dr. Ng Char Hong, all things about breast surgery and of course breast cancer. So welcome Dr. Ng and of course our two guests with us today, Miss Brenda Wong from marketing. Hi. And of course Michelle, she's a mom of one. So she's joining our panel discussion to learn more about breast surgery and breast cancer. So of course, in light of Pink October, we would like to actually engage on this topic to learn more with Dr. Ng Char Hong and of course all of us here today. So yeah, let's begin. The first question that we actually frequently got asked by the public is, what does a breast surgeon do?
Okay, so breast surgeons, basically our job is to diagnose, to treat patients with any breast diseases, either benign breast diseases and non-cancerous or cancer patients.
And what are the things that, what does the breast surgeon actually do? Who do they work closely with in the team?
So breast surgeons are a bit quite unique because our patients are mainly female. So they have a lot of demands, right?
But I heard male do get breast cancer as well, right?
Male do get breast cancer, but it's very few of them. It's like 1% of all the cases. Women is like 99% of the cases, right? So, so we work closely with our radiologists to get a diagnosis and imaging. We work with the pathologist to give us a result. We work with the oncologist to treat the patients, whether before our surgery or after our surgeries. Then we also have patient support group and quite a big group of people. Some are core groups, some are non-core groups. Yeah.
So Doctor, we have compiled a list of statements for you to address or even debunk. Firstly, finding a lump in your breast means you have cancer.
Not true, because majority of lumps are not cancerous.
Can you tell just by palpating the breast?
I don't have an ultrasound right? So we can tell, the lump is mobile or not mobile. But then sometimes if you can move around, they say, oh, if the lump can move around, it's not cancer, but it can still be. Some cancer still move around. So I always have an ultrasound machine in my room. So after I feel a lump, I probably put an ultrasound there. I have an idea what they are, then I'll send patient for a scan.
Okay, I want to go to my second statement, which is really interesting. Wearing a bra when you sleep causes breast cancer.
I've heard of this.
Doesn't. So
I think it's a total myth, but I would like Dr. Ng to address
a lot of people say, right, whether you wire bra cause cancer lah, don't wear bra better lah. That's like, you can wear wire bra, non-wire bra, full cup, half cup, whatever push-up bra, it doesn't make any difference, okay? The bra is for you to support your breast against gravity, right? Against pain, right? So that's all you do. If you want your breast to look nicer, and wear a bra because it supports it, right? It doesn't cause cancer, it supports your breast, yeah.
So actually, I just wanted to add on to your cancer mythbusters because, let's say, speaking about all this journey, it can be quite hard for them, right? Especially they just got firstly diagnosed. So one of the cancer mythbusters that I actually saw was eating antidepressants can actually sort of trigger more of the cancer cells, especially for breast cancer.
There's no direct correlation between stress and cancers. But obviously, antidepressant, people say antidepressant probably they have stress or they're depressed, right? So, but there's no direct correlation with that. But when you have stress, you obviously might smoke or you might drink more and those things. They might indirectly cause cancer. But so there's no direct link, but there are always things around it, other factors. So
Brenda, what do you think about having your breast checked now?
Okay, I have another myth. Does early mammograms detect breast cancer very early?
Okay, so mammogram, a lot of people ask, can I not do mammogram and just do ultrasound, right?
Pain,
Yeah, so I told you not very painful. Everything already. Yeah, but there are certain things in mammogram that you can't see on ultrasound, there's certain, when you do a mammogram, it's just an image of the breast, right? So a certain abnormality there. It's a very subtle one, or there are little dots, white dots that we see on mammogram that's early cancers that we cannot see on ultrasound. By the time you can see all those in ultrasound, it's probably a bit late. So that one that you see on calcium in the breast on the mammogram, it might be pre-stage 0 or stage 0 cancers. You probably take it out and probably that's all you need to do. If you wait, or you wait until you can see on ultrasound, or you can feel it, it might be not, a bit advanced. So you might still need like chemo or radio or something before that. So it does help, but also depends that you are not advised to do a mammogram at the age of 20 because at that time you can't see anything. But if you have breast cancer, even at 20, after diagnosis, we will do a mammogram just to make sure you don't have other things that will alter our management, how we treat you, right? So it depends.
Maybe you can tell us about the screening methods that we have, and also how often should we be doing breast self-exams?
Right, so let's start with the basic breast self-examinations. There's something that most women don't do, and they're not taught in school as well because it's kind of taboo to talk about breast and other things. So breast self-examination is something that we ask ladies to do, basically not to diagnose a cancer, right? So what we tell them to do is just to familiarize themselves with their breast, with the structure of the breast, with some breasts are a bit lumpier than the others. So it's just to familiarize with your breast. So when they examine your breast, you found, oh, why is this not there before? Let's get it checked. So that's basically what it is. So it can be cyst, it can be fibroid, yeah. Obviously also can be a cancer, right? So that is breast self-examinations.
How often should they be doing this?
Once a month, like on the 7th day of your menses to 10th day of your menses. That's where your breasts are less painful, less lumpy. That's when you check it. The main way of breast screening will be mammogram. Okay, so we encourage women to do a mammogram at the age of 40, either once a year or twice every 2 years, depends on the risk factors.
Painful not?
Yeah, I'm always scared of the pain.
Yes.
The machine is
to be honest,
okay,
I
a
not
lot of ladies say it's painful. It depends on few things. It depends on when you do it, right? Don't do it before your menses, right? Just do it after your menses when it's at least painful. And also choose those machines that are better, like 3D Tomo is probably better than the digital one, and digital is better than the classic.
So there's a difference.
Yeah, the different type. And also the radiographer actually put your breast into the machine. Some of them are better on doing that, some are not as skillful. The placement, compressions, everything make a difference. And so if you're anxious, of course everything will be more painful, right? So I sometimes tell patients, if you think it's going to be painful,
it will be painful.
Take some,
or it will be intensified.
Yeah, or take like 2 Panadol before you come. Like things like that. Sometimes it helps, right? So yeah, and if you come with friends, like a group of you, and you're chatting before you go in, it sometimes do helps. Yeah.
So actually I have a question, like there are some cancer patients sharing when we get cancer, like this is the end of the road. So like, is breast cancer the hardest to cure?
No, breast cancer have one of the highest survival if you treat early, right? Sometimes we always say if you have to choose between all the cancers that you have, one of the skin cancer probably one of the easiest to
better prognosis lah.
Better prognosis. Breast is probably second or third, right? So if breast cancer is the one that causes death, a lot of death, then you don't have so many survivors in the world, right? So most of them survive, right? So it also depends on the stage and things like that, right?
So doctor, actually there's another question that is frequently asked. I think you get this question a lot as well. So actually, what are the positive and negative sides of breast conserving surgery versus mastectomy?
Okay, so as you know, a lot of patients last time have mastectomy, right? And then they survive, right? So if someone now have a breast cancer, so they will listen to their friends, auntie, grandparents, whatever. Oh, you should remove your breast, then you survive. It's not no longer that kind of statements, okay? So nowadays, if we can conserve the breast, we will conserve the breast. In fact, there are more and more studies and evidence show that breast conserving surgery actually give you a better survival.
Why is that?
Nobody knows. So, and the thing is probably because you have radiotherapy and things like that as well. And then, to be honest, nowadays, a lot of time, the treatment of breast cancer no longer just about removing of the breast. It's about removing of the cancer, but also because of the advancement in the chemo, in the targeted therapy, in the hormone therapy, radiotherapy, everything else add together make your survival higher. So it's a package. It's no longer just about surgery.
So we were talking about treatment methods for breast cancer. I think there's radiotherapy, chemotherapy, gene therapy as well, hormone therapy.
Hormone therapy, immunotherapy, targeted therapy.
Okay, and all of this is readily available in...
Yes, very well in Malaysia, very well in Picasso. So not everyone need everything. So it's kind of like depends on what cancer you have, what stage you have, what subtype you have, and that determines what treatment you need.
So how many types of breast cancer are there? Like in...
Well, we're looking at in the big umbrella.
umbrella categories,
So there's
yeah.
4
HER2
types.
or something, right?
4 types, yeah. So it goes into 3, right? You are estrogen positive, progesterone positive, and HER2, right? This ER, PR, HER2 lah. So you can have ER positive, PR positive, HER2 negative, negative, positive, 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 positive. These 4 main ones. Although there are subcategory after that, which we are not talking about that, but there's these 4. So if you have negative, or negative, positive, your risks are highest. They are the most aggressive ones. So these 2 normally we just say most of the time is chemo first before surgery.
Is it always chemo first then surgery?
Okay, so last time most patients will have surgery, then before chemo. Nowadays, because of all the updates and the drugs that we have, nowadays, to be honest, about 50 to 60% of all my patients actually have chemo first before surgery. That's because how the treatment have changed, how the management have changed. That's why we always tell patients do a biopsy first. Do a biopsy.
That's the most accurate way.
Yeah, biopsy and then see what's the hormone status of the cancers. Then we decide what to do after that.
So Dr. Ishina, what's your funniest story like? Have you ever encountered something that, I mean, like light-hearted, like since we talk about breast cancer, people always like, it's such an arduous journey, right? But what's the light-hearted moments you get out from this?
Nowadays, right, all my patients who I treated them like many years ago, like 10 years ago, those patients, when they come back to see you, they're like, wow, they survive all the times. And they
must be very satisfying.
Yeah, and then we go out for lunch, dinners, we have parties, so those are the times that you know that you have made a difference.
And life continues for them.
Yes, correct.
Yeah.
And life always continues, right? A lot of times you tell them, don't just sit at home think, when will my cancer come back? Like just do your normal things and see more things, do more things. So change how you look at things.
So I think
things.
Talking about like life perspectives, how has being a breast surgeon, you see so many patients who think that they're going to die because of cancer. How has that changed your mindset?
Enjoy your life more. Go more holidays.
Boss, approve my leave.
More purposeful driven life.
Because it's like, for all of us, we work, right? So we also need times to wind down and to do the things because life is
short.
Yeah, life is short. So you cannot just work. Agreed?
Yep.
Yeah, let's go on holiday.
Okay, and I think, do we have any questions?
I think let's do, before we end the show, maybe a last key take-home message for our viewers.
For viewers, so don't be afraid. Do your breast examinations. If you need to do mammogram, it's no pain, less pain, okay?
No need to do it, I'm still young.
And when you get a diagnosis of breast cancer, just get it treated and be more mindful of your breast and your changes in your breast, and then it probably will save life. So, yeah. Okay?
So yeah, with that, we are actually wrapping up our second episode with Hot Seat with Dr. Ng Char Hong.
Is it hot?
With rapid fire questions. So thank you so much, Dr. Ng, for joining us today. Of course, Michelle and Brenda with us here today. So if you wish to learn more about Hospital Picaso or even breast consultation, please log on to our website www.hospitalpicasso.com, and of course do subscribe at the YouTube channel and all of our social media page. So stay tuned for our third episode with Dr. Tan Chi Kiang, where he'll be talking more about cancer treatments, and of course he's our consultant oncologist. So yeah, with that, thank you so much everybody, and
Bye.